I suppose really today is a culmination of a lot of work that's been done by my colleagues in the quality improvement area of the mental health division. I think it's a great achievement. I think it's an achievement that just sort of doesn't stand in isolation, because then it would be rather meaningless. It's the fact that as with other programs and projects within the mental health division, it should improve the experience of service users, patients, families, carers, supporters of the mental health services. Perhaps as importantly, it will be of huge benefit to clinicians and other staff members who work with those patients and their families. They will have the assurance that they're carrying out their work in ways that are fully compliant with all the regulatory requirements, which can be quite onerous and which are very important, of course, to ensure that proper services are delivered. So this is a framework that will benefit everybody in what we call the triangle of care: patients, their families, and service providers.
Hi, I'm Buckley. I'm a service user representative. I was on the subcommittee for training connected with the Best Practice Guidance for mental health services. I'm really excited about the developments that are in the document, particularly the training modules and the possibility really for service users to become actively involved in assessing quality in mental health and very likely and hopefully influencing change. I think this is going to be very important, and I think it's a great innovation and a step for service users, for carers and for families. I'm glad to be here today.
My name is Brophy. I am the clinical advisor to the National Office of Suicide Prevention, and also I'm a consultant psychiatrist working in Wicklow. Today is about the launch of the guidelines in regard to best practice. They offer a comprehensive, complete guide to improving practice, meeting compliance, meeting regulations. But the process, I think, will mean that people are more confident, they're less burdened by the requirements of regulation, their teams are clearer about what their roles are and what they can do. And I guess at the end of all of that, we will have better services in our own terms, which I think is the reason I welcome them so much.
My name is Sabina Fahy and I'm a consultant psychiatrist, and my team were involved in one of the pilot sites of looking at the quality and safety standards. And I suppose one of the challenges we had was the time commitment, and also I suppose getting buy-in from team members. But I'd advise other people who are setting out on the self-assessment journey to set aside adequate time to involve everybody from the team, because it does involve all of us. Every team member should be involved in quality and safety. And finally, I suppose about using the quality champions that will be trained by Linda and the team, because they will be the ones that will have the expertise and advice in terms of what you need to do and how you need to complete it. This process will help us to fulfil all our requirements in terms of regulations and all of the policies and whatnot. So it's actually going to support us in our day-to-day work as opposed to being a burden to us. So I hope you enjoy the process.